You know, when it comes to mental health, the biggest step is finding help, but some of us don't really know where to look. So this morning, we're joined by clinical psychologist Dr. Linda Seltzer-Sucher. Dr. Seltzer-Sucher, thank you so much for being with us today.
My pleasure.
First of all, what should we do if we're at the point where, like, okay, I'm not feeling like myself, I'm really down, I'm struggling. If we need to ask for help about our mental health, what do we do?
You can call your physician. In the community, there's a lot of community resources. You can call religious leaders. You can look online. There's resources available. Calling people's insurance company. And one thing through COVID is people are able to do virtual therapy visits. In the past, we weren't able to do that. So even if people don't have the transportation to get somewhere, or physicians or clinicians aren't in their offices, they're now able to reach out, do Zoom links or FaceTime phone call therapy sessions. So
And
virtual therapy is great right now.
that is a game changer for so very many people. You know, every therapist is different. What's the key to finding the right one to fit you?
Somebody that you feel connected to, that you can relate to, a good listener, but also somebody that may be able to share in great ways for people to solve problems.
What are the signs or symptoms of depression or anxiety that we should be looking out for?
Excessive sadness, and prolonged sadness, activities that you used to like to do, you no longer want to get out of bed, you no longer want to go to work, you're not calling your friends anymore, you're not seeking social situations, even though we have to adapt to social situations, you're not reaching out to people. People may have guilt or hopelessness or low energy, their appetites may be changing, they may have problems falling asleep, staying asleep, or waking up. Some have thoughts of suicide. Not everybody has thoughts of suicide. You may have a physical response. Your heart's racing, or you feel like you're going to pass out, or people have flutters in their stomach or butterflies, or
And what advice would you give for those who are spending the holidays alone to avoid isolation or depressive thoughts?
so we just have to accept the situation right now. We are way more resilient than we think. We have to be flexible and adaptable. This is a temporary situation, but reaching out to other people through Zoom calls, connecting this way that we're doing the interview. There's watching movies, finding something, knowing the day is going to start and the day is going to end. This is not going to last forever. And then this is all going to be a part of our COVID memory.
It will not last forever. There you go. Dr. Linda Seltzer-Sucher, thank you so very much for your help and advice this morning.
Happy to help.
Of course,